Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, this past week, the president gave his big health care speech to Congress. The debate is on in Congress on the health care reform bills, and it's on Pennsylvania Newsmakers following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program, and as always, thanks for watching. Well, the health care debate, it is dominating discussion in the country, and it's going to dominate discussion on Pennsylvania Newsmakers this week. We have two experts bringing their viewpoints to us. First on the show is Dr. Stuart Shapiro. He's been on the show many times. He's the president and CEO of the Pennsylvania Healthcare Association. Dr. Shapiro, welcome.
Hi, Terry.
All right, I'll tell you what, before I get into this, and you have some thoughts that you've put into paper, you've written an op-ed piece that has appeared around the state. I want to talk about that. These are suggestions that could help move the health care debate along. Have you ever seen a debate quite like this? It's on all summer, not much leadership from the president. They're sort of ambling around without any direction. Is that kind of odd coming from this administration?
It is kind of odd, especially since the president understands social media.
Yeah,
and he should understand that today we're in an environment where you can't sit back. You have to take leadership. And especially on an issue like this, he's got to be very clear.
Yep.
And he's got to be able to bring the parties together.
Yep, and he's not certainly done that. You're right. Well, look, I want to get right to this point. Look, if the President of the United States would pick up the phone and call you and say, Doctor, give me 3 or 4 ideas about what I should do, what's your suggestion to the President?
I'd be real clear. I'd say, Mr. President, don't just invoke Teddy Kennedy's name. Mm-hmm. Step into his footsteps. Understand that you have to take baby steps.
Right.
Follow Kennedy's lead on civil rights or disabilities. The first bill that really did it, took important key steps and laid out a roadmap. Then I'd put the following 4 elements into a roadmap. I'd say, Mr. President, lay out that universal health care is a goal, but we're not going to start there. Start with covering all kids. Mm-hmm. Start with mandating for large employers.
Right.
Second point, I'd say, Mr. President, define a minimum benefit package. Provide some subsidies for having it purchased. Make sure there's no discrimination for pre-existing illnesses. Make sure that it's community rated, and give up the public option. Mm-hmm. Don't let the liberals in the House dominate you. Mm-hmm. Then I'd come to the third point. I'd say, Mr. President, put in real cost controls. Medicare, when it was passed, did not. And the curve went like this, even though it was projected to go like this. When the end-stage renal dialysis program was implemented, or right. Part D, they said the costs would be here, they were here. I'd say, Mr. President, put in some real cost controls that pays based on quality of services, not quantity of services, which is the way we do it today. And I'd say, don't reimburse for brand new drugs or new treatments that have only marginal benefit. Mm-hmm. Make sure that they really pass muster. Right. And then I'd take a fourth piece. I'd say, Mr. President, bring in tort reform.
Right.
The only way to get Republicans on this bill right. is going to be with serious tort reform. Reduces defensive medicine, put in some tort reform, and we'll save $200 billion a year. Those 4 elements is what Teddy Kennedy would do. It's what leadership would do, and it will produce a bipartisan compromise.
Yeah, well, what's, I think, fascinating about this discussion is that the American people, when we started this debate, were for universal coverage. Not, and in a sense, for a public option until they figured out that the public option, in a sense, could compromise their own health care plan. In other words, that a public option could drive out of existence all private insurance, which is, I think, a real fear. And the other point that you make about tort reform is that maybe the president doesn't want to take on a trial bar. I mean, the trial lawyer is a big constituency. But on this program, over and over again, we've had folks like you come on and say, if we have tort reform, serious tort reform, that would reduce the costs, and you could still make sure that injured parties, plaintiffs, were taken care of.
Well, you have to make sure that when mistakes are made, and serious mistakes are made, that they're seriously compensated.
Yeah.
But to just practice the kind of defensive medicine we do today,
Right.
to avoid frivolous lawsuits,
Right.
is folly. If you look at the House bill, 1,018 pages. Tort reform is not mentioned. In the entire, all the Senate bills led by Democrats, tort reform not even is near the table. And that's unfortunate, because if you want a bipartisan approach, you have to eliminate the public option, which I happen to think in the end will come back. And you could set up triggers so that it will come back if costs aren't controlled. So it's still there in the bill, but it's a backup. But unless you do it this way, health care reform is going to be lost in this Congress.
All right, we're going to take a break. When we come back, probably nobody knows more about the Medicare program than Dr. Shapiro. It's a huge program. It's important to Americans. We'll talk about that and more following these words.